the addicted brain is afflicted by the very fact of addiction, by what the drugs or compulsive behaviors do to the brain. And they actually cause brain damage. So that the recovery process is also one of physically reclaiming your brain. And it doesn't take 3 weeks. You know, it's a long process. But apart from that, that brain which became addicted wasn't right in the first place. So we have this myth again that drugs are addictive. Well, obviously drugs are not addictive, are they? If I ask you this question, is alcohol addictive? Is it? Well, if I ask you this question, in fact I will ask it. How many of you had a glass of wine or beer in your life, ever? One. Okay? And out of those, how many are willing to say that they've had a drinking problem? A much smaller number. If the alcohol was addictive in itself, you should all be alcoholics, right? So the addiction is not in the alcohol. Most people who try heroin or cocaine or crystal meth, even a powerful drug is crystal meth, even repeatedly, never become addicted. Which is not to say that I'm advocating that you should use them. I'm just saying that it takes not just the drug, but the drug in combination with a susceptible individual. And the question is, what creates the susceptibility? So what creates the susceptibility on the physiological level, on the brain level, then is those early adverse childhood experiences, because it turns out that the human brain develops under the influence of the environment. And so if you're looking at right now, you've got this epidemic in North America of children being diagnosed with all these disorders. ADHD, which by the way, I was diagnosed not as a child, but at age 54. Oppositional defiant disorder, Tourette's, autism, you know, the numbers is burgeoning, and millions of kids are being medicated. And by the way, millions and millions of kids are being medicated, and some of them with medications that we don't even know if they're safe to give to children, because the studies have not been done, and they can cause terrible side effects. But we think that there's this epidemic of all these childhood diseases going on. But what's really going on is that the conditions for healthy brain development are not there anymore. Because for healthy brain development, you need the presence of emotionally available, nurturing, parenting caregivers, consistently available. And to the extent that that's not available to kids, their brains may not develop properly. And then 5 years later, they're diagnosed with some kind of disorder. And the more stressed the parents are, the less the kid's brain has the chance of developing properly. Then they get some kind of disorder, which makes them more prone for addictions. So the susceptibility to addiction is not universal. And although in a culture like this, it becomes almost universal, if you include all the addictions to behaviors. But certainly the susceptibility to drugs is not universal, which means to say that the drugs are not in themselves addictive. It's a question of who's susceptible and why. And if you look at who's susceptible and why, it's those kids that had the worst conditions for brain development in the first place. I'm talking now about the severe drug addicts, the street corner drug addicts. These people were invariably abused, traumatized as kids. And it's that trauma then that misshapes the brain, which makes them more likely to use. So that, as our guy said to me in detox a couple of years ago, when I asked him what the heroin did for him, he said, you know, Doc, I can't tell you exactly, but the closest that can come, he says, is let's say you're sick as a kid and you're a 3-year-old and you're shivering, and your mother puts you on her lap and wraps you in a warm blanket and gives you some warm chicken soup. That's what the heroin feels like. What is he looking for? He's looking for love, for love, for love, for love.